All right, this is just a response to your interview questions. I've done this before for other students, and I know how busy you are, so I thought I would do this to see if it kind of helps speed things up for you. Question number one, how did you become interested in your field? My interest in physical therapy started as a child when my aunt would go to physical therapy. She had cerebral palsy, and so I would go with her, and the physical therapist would give me exercises that I could do with her to help her to work on various things. And, it was as simple as playing catch with her and throwing a ball and doing things like that. But I really enjoyed being able to uh, get in there and help somebody and do something. And I thought it would be an interesting profession. Then when I was in high school, I worked out with a gentleman who was a physical therapist, and so he kind of told me a little bit about it, and it really kind of sparked my interest. What do I like about my question number two? What do you like about your profession? The thing I like about it the most is it's extremely rewarding. People come into you, they're hurting, they can't do certain things they used to be able to do, and you can use your talents and skills to be able to help them to achieve their goals and get back to what they wanted to do. And it's extremely rewarding. The other thing I really like about it is it's extremely varied. So every patient you have is different, even if they have the same diagnosis. So if my first patient of the day had a rotator cuff repair and my second patient of the day had a rotator cuff repair, they're going to present differently because they're different people. And so it keeps you on your toes and keeps you moving ahead like that. So what do you dislike about your profession? Sorry, that was question three. What do you dislike about your profession? I guess the thing I dislike the most is some of the paperwork that's involved with it. And I don't so much dislike the paperwork because I understand that it's a necessary part of the job. What I disliked was, especially when I was supervising, is that some insurance companies, it seemed like, would deny right off the bat, just hoping that you wouldn't have the perseverance to go ahead and resubmit the documents, even though you submitted everything correctly the first time. So I just didn't feel like that was appropriate or fair, but that's about the only thing that I really dislike about the profession. Question number four, what are the most important skills for your profession? Number one, I think you need to be knowledgeable of anatomy and physiology. If you understand how the body works, then you can kind of figure things out. Secondly, you have to be a good communicator, and I would say that goes both directions. So not only do I have to be able to completely hear and understand what the person's telling me or showing me by how they move, so I have to be able to receive that information, but then I also have to do a good job of communicating that information back to them and communicating it in a way that will motivate them so that way they will want to do the exercises that I'm giving to them, kind of like a coach would in sports. Question five, how are other areas or subdisciplines of kinesiology involved in physical therapy? I work a lot with athletic trainers because I've done a lot of sports physical therapy, so I work a lot with athletic trainers. Exercise physiologists, especially like with cardiac rehab and doing some stuff like that. So those are probably the biggest areas of kinesiology that I've worked with. Question six, how have the knowledge and skills learned in your profession helped you in your life? So with physical therapy, many times you have to look at the cause of a problem and not just the symptoms of it. So for instance, I may have pain down my arm, but the pain may not be coming from there. It may actually be coming from up in my shoulder. So I need to address the cause of the problem. And similarly, maybe I have a disc problem in my back. Well, my symptoms may be down in my calf, but the cause of the problem is actually coming from my back. And so it has really helped me to focus on really getting down to and identifying the cause of a problem and not just the symptom of the problem. And I've used that in multiple areas of my life, whether it's in family relationships or teaching or a variety of different things. And so that's been very helpful. Question 7, how many years of school did it take you to become a physical therapist? For me, it took 6 years. So I had 4 years of undergraduate. I got an undergraduate degree in biology, and then I went and got a master's degree in physical therapy. So that took an additional 2 years beyond the bachelor's degree. Now, though, they have switched to a doctorate degree. And so I think those take about 3 years. Each program's a little bit different, but it's an entry-level doctorate of physical therapy, whereas I had to go back to get my doctorate of physical therapy after I had already been out working for a little while. Question 8, what are your specific interests in physical therapy? For me, it's an outpatient orthopedic setting is where I have worked predominantly. So a lot of sports therapy, working with athletes, and also manual therapy. So like doing joint and soft tissue mobilization to help get the person's body moving better. What areas are, question 9, what areas are changing in physical therapy? To be honest, I see a lot of change coming in physical therapy with pressures. You're, as a physical therapist, you're having to be more focused and more specific in your evaluations. We used to be able to look at the person's entire body and kind of identify all these different possible things that may be affected. However, with decreased reimbursement and time, you're having to be more specific and more focused in your evaluation. And so it's causing us to become better therapists, I think. Also, there's more of an emphasis on outcomes based. So not just emphasis on the things we're doing, but emphasis on, are those things being beneficial? Are they helping our patients achieve their goals? So, and question 10, what is a typical day like? What are your responsibilities and what advice do you have for someone preparing for a career in this field? A typical day can be very challenging to describe, at least. A lot of it depends on the setting that you're in. Okay, so if I'm in acute care or I'm in a skilled nursing facility, I may get a list of patients and I just go and see them. And maybe if I'm working in a hospital, somebody goes down to get an x-ray. Well, then I just move on to the next person and then I come back to get that one. And those treatments can really be varied. It depends on what their needs are. So maybe it's somebody who's had a stroke and we're getting up and walking them, or maybe they can't even stand up for balance. So we're just working on them rolling side to side in bed. Whereas in an outpatient setting, my patients are scheduled probably about every 45 minutes. So, and then they will come to me and it's on a very specific schedule. And so, but even that can be extremely varied. So my first patient of the day could be somebody who has torn their rotator cuff, and maybe he's a 50-year-old man and, just kind of wear and tear on his shoulder. But then my very next patient could be a 16-year-old who tore his ACL. And so it can be quite varied as you go through that. Responsibilities as a physical therapist: we do the initial evaluation, we design the plan of care, then in subsequent visits, we're implementing that plan of care, oftentimes in conjunction with a physical therapist assistant using a team approach. And the treatments can vary. Again, it just depends on your patient's need. It might be gait training, it might be joint mobilization, maybe some therapeutic exercise, maybe we're working on balance and coordination with them. So lots of different possibilities that are there. We always bill for our services as well. A number of physical therapists are getting into administration, so there may be some financial stuff you're looking at, or maybe productivity responsibilities for the different people in the clinic there. As far as what advice do I have for someone preparing for a career in this field? Number one, get a good solid foundation in anatomy, physiology, because that's going to help you with understanding how the body works. Anatomical kinesiology, extremely important course to take and have a good understanding of. But the other thing I would really recommend someone to do is get exposure to a variety of different settings. Spend some time volunteering or working in like an outpatient setting. Spend some time in a hospital setting, in a long-term care setting, and maybe some home health, and get a variety of pictures of that. So that way the person has a better idea of not only what they like, but what happens in each setting. Because if you understand that, then it allows you to be a better therapist, because as the person transitions from the hospital to home health, and from home health to maybe outpatient rehab or a skilled nursing facility or something like that, you're going to know what things are needed from each of them, and you're also going to know what was required or what types of things they were probably doing in those settings. So the more settings I've worked in, the more I have a better understanding of those type of things, and it's been very helpful for me.